Hi, everybody. Welcome to GW Center for Integrative Medicine. I'm your co-host, Dr. Kogan, Chief Medical Officer and Associate Professor of Medicine here at GW. Today, I'm going to make a short video about a brand new study that just came out a couple of months ago in JAMA, and we're continuing with the topic of cognitive health. So I'm going to go ahead and share my screen. So this study describes effects of a cognitive lifestyle optimization on an older adults who live in a community and who are relatively healthy. So this is on average, they took patients who were 68 years of age. Roughly, they took over 2,000 patients, and they split them up in two groups. They split one group into what they called a structured intervention, and we'll talk about what that exactly meant. And another one was self-guided educational program. They roughly split them up in half. It was random assignment. The amount of APOE4 carriers was about the same, about 30% in each group, and they tracked the patients for 2 years. So what were the structured component versus self-guided? So in structured component, as you can see, they supervised physical exercise. They were recommending specific types of activities. They supervised nutrition, made sure that patients try to adhere to what's called the MIND diet, which is very well evidenced, and there's lots of research done on this, and it seems to be one of the several good diets to do if you're at high risk for developing cognitive decline. They included computer cognitive training that was provided and encouraged for all people in for all participants in structured program. They also supported social challenges by offering entry into peer support group. And lastly, they also provided ongoing health coaching. So the structured program was quite structured versus self-guided. They just gave publicly available information. They did provide some clinical assessment as part of just continuous trial. So they did look into blood work in both groups, and that was similar. But they didn't really track the patient's adherence, and they didn't really tell them exactly what to do. They simply gave them information and said, this will help you, go ahead and do it, and we'll track we'll look at your parameters for 2 years. So what exactly happened? Well, so what happened is, first of all, the randomization worked well. There were no differences between the two groups, so this was a good study. And you can see that over 2 years, was a substantial continuous improvement in cognition. And the group that had a structured recommendations did a lot better. Now, this looks like not a lot of difference here on a graph, but it's actually a 20% difference roughly, and it's quite substantially important. I also want to point out that, as you can see, there was no plateauing. This is really critical. It means that on average, when people started, they were 68. When they finished, they were more than 70 years old of age, and they've continued to improve their cognition. This is a very critical message. The other really important part of this study, why I think it's so important, is that they were able to demonstrate that you can not just improve cognition continuously, but even the patients with APOE4 carrier status, those are the patients at much higher risk of Alzheimer's disorder, continuously to improve. And they improved pretty much the same way as the patients who do not have an APOE4. We already suspected that the APOE4 genetic risk responds much better to the lifestyle modifications than patients who don't have APOE4, and the risk is normalized to the average risk. And this is yet another study supporting that notion. So I hope that politicians, aging community leaders, academic leaders that are involved in managing complex patients with cognitive decline and involved in the community work of preventing cognitive decline will take this study into serious consideration and start evolving and developing programs on locations. I also hope that we will see an AI-supported platforms such as apps and other interventions. And I will personally be working with some of those programs, and I will at some point discuss this in the future. But for now, just suffice to say that, of course, in our cognitive program at GWCIM, we've, of course, very aggressively engaging patients into all of these methods, whether they already have cognitive decline or they're at high risk. But again, as I said, it's nice to see another paper supporting what we already do in clinical practice. And hopefully more places will start engaging in this aggressively leading to an improvement in cognitive health for our older adults. Hope you have a good day. Stay tuned. If you like this video, please subscribe. It helps the channel, and you will not miss when the next video comes up. And please do also comment if this topic is of interest to you. We'll continue with it. If there's something else you would like to see on this channel, we'll try to accommodate. Wonderful day to everybody. Take care. Goodbye. Stay safe.